Ready to go? Okay. Good morning. Today is October 6th, 2020. This is a regular meeting of the Kings County Board of Supervisors. Madam Clerk, please call the roll.
Joe Neves.
Here.
Richard Valley.
Here.
Doug Verboon.
Here.
Craig Peterson.
Here.
Richard Fagundes.
Here. All 5 members are present. We are ready to conduct business today. Would you all please rise for invocation from yours truly? Let us pray. Dear Lord, please allow us guidance to get us through these troubled times. Please give us patience, and please give us good direction to get through the COVID-19 situation. And let's pray for our first responders through all the fires in California. And let's have a good, exciting week. Amen. Okay. Pledge allegiance. Ready? Luke?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we're going to go to unscheduled appearances. Any person may direct the board at this time on any item on the agenda or any item that is within the subject matter jurisdiction of the board. I believe we have Lupe Villa on the line right now. Lupe, it's all yours.
Good morning, Mr. Chairman. How are you doing today?
Good. How are you?
I'm doing great. Thanks for asking. Chairman, members of the board, Lupe Villa with the Elections Department. I just want to give you guys a brief update in regards to the upcoming November 3rd general election. As of yesterday, we mailed out 57,293 ballots. I confirmed with the U.S. Postal Service this morning that they've hit the mail and the dock. So some voters reported yesterday receiving ballots late in the afternoon. So my assumption would be that Kings County voters will get their ballots by the end of today, if not tomorrow morning. We are prepared to start our poll worker training beginning tomorrow, Wednesday, Thursday, and Friday of this week. We'll be deploying the 6 polling places throughout Kings County, 8 ballot drop boxes throughout Kings County that are open 24/7. And we started receiving our UOCAVA, which is overseas voters, their ballots last week. We received a total of 13 so far. We had our first voter in office yesterday. The lady was traveling out of the state and wanted to cast a vote before leaving to Arkansas and came in and voted in the office. We're also expecting some delays at our polling places. I encourage you to share the message. Any voter wishing to go out to a polling place may do so. However, they should expect delays due to COVID-19 and the guidelines that we must follow in regards to disinfecting after each use. All of our poll workers will be trained to disinfect every single item that is touched by a voter, to include pens, stylus, counters, anything that is touched will be disinfected before it's used again by a second voter. So please share that message. Expect delays. You're welcome to come to a polling place, but it's not going to be your typical election day. I also ask that you support me in promoting Where's My Ballot? That is a ballot tracking system that is being offered to all voters free of charge. This promotion started a few months ago as I presented a quick study session to the board. I ask that you continue to do that. It's where'smyballot.sos.ca.gov. You'll be able to receive notice. I received my notice yesterday that my ballot was being mailed to me. So we need people to register to where'smyballot.sos.ca.gov, and they'll get alerts of where their ballot is at in the process. Also, if there's any voter that would like to check their status for the November 3rd election, they may visit voterstatus.sos.ca.gov. That is voterstatus.sos.ca.gov. Any person wishing to register for the November election may do so by visiting registertovote.ca.gov. That is registertovote.ca.gov. And any member of the community that has any questions regarding elections may visit our website at votekingscounty.com. votekingscounty.com. I urge that you share the message with your constituents. If they have any concerns or questions regarding our election, they're more than welcome to reach out to me at 559-852-2433. That is my direct extension. Or they can call the office at 559-852-4401. It is important that I receive your support as we move forward to this election. You know, it is a critical time that we're facing. We're facing a pandemic. We're facing challenging times. Therefore, your support would be greatly appreciated. If any of your constituents have any concerns and are sharing those with you, please refer them to me, and I'll be more than happy to address those with them. Now, I take great pride in the elections department. I think we're doing a great job moving forward, and you know, we're here to ensure that we have a safe and transparent election. Also, any voter wishing to surrender their ballot at a polling place, they may do so by bringing their ballot. If they don't have their ballot, we can suspend the ballot that was mailed to them and reissue them a new ballot. So they're welcome to do that as well. At this point, it's the end of my brief presentation. I welcome any questions you may have.
Thank you, Lupe. I know the great Supervisor Joe Neves always says vote early and vote often. So does that still work for this election?
Yeah, the early portion of that statement is very true. Vote early, or say not often. Only vote at election time. So,
Okay.
yeah, we welcome people to come on and vote early. I think by relaying that message to our voters in Kings County, it's going to bring a safe election to us, both fiscal and in our own health. We don't want people congregating at polling places given the current pandemic. And in regards to safety, I reached out to our local sheriff and every single law enforcement within Kings County to include the CHP, so they know where we're going to be at, so they know where our drop boxes are going to be at. And I asked them to, you know, increase their patrol to ensure the safety of our voters. Sadly enough, we can't have any law enforcement posted at the polling place, but they can surely patrol and make sure everything is under control. I don't expect to have any type of protesting, but that's just my assumption at this point in time. We have not received any concerns from any political party in regards to potential protesting, but increasing patrol of our ballot drop boxes and polling places is going to bring a peace of mind to our voters.
Thank you. Appreciate that. So I should get my ballot today and get it filled out and get it back in. I expect everybody to do the same. So,
yeah, feel free to drop it by our office. You know, take advantage of our 8 Dropbox locations that we put out through Kings County. There's 3 in Hanford. One is going to be at the Home Gardens area. The second one is outside in our parking lot. We got one at Hanford High East, right off of Grangeville. We got one in Armona at the Senior Center. We got one at the Central Union School on 18th Avenue. We got another one at the Recreation Center on Cinnamon Drive in Lemoore. We got Avondale Library, Corcoran Amtrak Station, and those are 8 ballot drop boxes.
very good.
Mr. Chairman?
Reason for no one to vote. Yes, sir, Mr. Valley.
Mr. Chairman, could I just ask this, that one is I very appreciative. That was a beautiful update. But could I suggest that the board would agendize this conversation for the benefit of the public, one that they know that Mr. Villa is going to give an update on the election, because I think it'll be very helpful just from what we're seeing on social media. And I won't go into it because it's unscheduled, but Mr. Villa was very helpful in Corcoran this week, and some of the things he said are spot on. But I would like the ability to be able to talk more freely, and I think we could all do that for the benefit of the public and the trust of the public. If we could, even if it's as simple as update from Lupe Villa, Department of Elections, if the board would consider that, Mr. Chairman.
And you can do that with a consensus, Mr. Chair.
How does everybody feel about having it agendized so we can get it on the record and get people to notice that what we're doing is correct? We're good?
And you know, with Mr. Chair, I think we've only got 4 more Tuesdays, so maybe we should just put that on for the next 4 Tuesdays.
Yeah.
And just have updates.
Lupe, that okay? Update it every week for the next 4 weeks?
Yes, I can definitely do that. I'm sorry I won't be able to do that on election day, which is the 3rd, Tuesday. But any time, any Tuesday before that day, I'll be more than happy to come on and give you guys a weekly update. There's certain things that we cannot share per election code, but most definitely I can give you updates on usage of our ballot drop boxes or any concerns from our communities that may be impacting the elections. So, yeah, I would definitely do that.
Okay, we can still have it on the agenda on election day so we can discuss it. And I don't think any of us are on the ballot, so I think it'd be okay to do that, right, council?
Of course, you could even discuss election process even if you were on the ballot, but I'm seeing consensus of 5 in favor
Yes.
of agendizing it weekly through up to November 3rd.
Yep.
Okay, good. Thank you.
Thank you. Thank
Okay,
you, Whoopi.
we'll talk to you guys next week. Thank you so much for your support. And again, please promote a safe election. Vote early, not often. Thank you so much.
I had it half right.
Yeah, you did. Thank you so much, sir. Appreciate it.
Okay, we have Rebecca Campbell has her hand up. Rebecca?
Okay.
Okay,
Good morning. Can you hear me okay?
yeah, we hear you.
Okay, I just wanted to, good morning, Mr. Chair, members of the board. I just wanted to notify the board that regular item C will be pulled this morning from the agenda.
Yep, got it.
Okay, thank you.
That's it?
That's it for now.
How come we can't see her when she talks? Okay,
There you go. Can you see me now?
yeah. Yep, we see
Are
it.
you on your iPhone?
No, I'm on my computer and I have my daughter's Zoom headphones on for her school.
All right. I asked, I was joking with Rebecca this week and I said, hey, try doing the meeting off your iPhone so you could see how I did it for like 26 Tuesdays.
Yeah, it's difficult.
But I'm glad she's got a good monitor. It looks good.
Thank you. Thank you.
We have anybody else online? Mary Gomez. Mary, are you on the line?
Morning.
Good morning.
Good morning, board members. My name is Mary Gonzalez Gomez, and I live at 2001 Bell Avenue, Corcoran, California. I am here today to speak to you on the subject of the COVID-19 data as it relates to the Latino Hispanic population here in Kings County. 66% of the Latino Hispanic population in our county has been identified as COVID-19 victims, and 46 of which has lost their lives. As a Latina woman living here in Kings County and one who has lost family in Corcoran to the virus, these numbers bring me fear and concern. Many of us have reached out to Supervisor Richard Valle with our concerns on testing, and we are pleased to learn that a plan for COVID-19 testing of farm workers in this district was being considered. Community leaders in Corcoran supported this plan. And I want to thank each member of the Kings County Board of Supervisors for your support of this unmet need. The new data from Kings County Public Health appears to support the fact that the Latino Hispanic population needs to be tested in a way that they feel safe and not intimidated. The fact that we as a county need to move forward with the testing of our farm workers and families in Avenel, Cattleman, and Corcoran is real. Corcoran depends on our representative Richard Valle to work hard in representing us, and he has done so. We need to continue with a plan for testing of our farm workers to bring our COVID numbers down, to open our schools, our classrooms, and to open our businesses. Governor Newsom has provided us with a plan to bring our numbers down, and we now have the ability to get Kings County off the watch list by testing the most vulnerable and the poorest in our county. And with all due respect, my question to you, board members, is where are we in the process to move forward with a plan relative to the much needed testing of our most susceptible, vulnerable, and poorest in the county, which are the farm laborers and their families? And why does it appear that there is an attempt to silence Supervisor Valle on this issue? There seems to be a decline to the plan for testing of the farm workers, and we're depending on you to put the testing of farm workers in motion. We need our representative Supervisor to move forward with this. Each day is unpredictable, and there are lives depending on your decisions. And I want to thank you for your time. I ask you to stay safe and to stay healthy. We need each one of you, board members, and especially during this time of crisis in our rural communities. And I want to thank you for your time.
Thank you, Ms. Gomez. Appreciate your input. Last night, our health department issued a press release stating just those facts that you presented today. So thank you for your concern, and we'll be on it and get everybody tested. And remember, just like we would like you to vote, you vote early and vote often. You need to get tested early and often, and at least once a week. Even if you think you're healthy, it helps the community. So thank you very much.
Thank you, board members.
Do we have anybody else online? Nobody? Okay. We're going to go on to item number 3, approval of the minutes. Approval of the minutes from September 29th, 2020, regular meeting.
Move for adoption.
Moved by Supervisor Peterson, second by Supervisor Fagundes. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Aye.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
5 in favor. We approve the minutes as presented. We're going to go on to the consent calendar. All items listed on the consent calendar are listed as one motion unless a supervisor would like to pull an item and vote on it separately. What is your desire?
So move, Mr. Chair.
Moved by Supervisor Neves, second by Supervisor Peterson. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
5 in favor. We have approved the consent calendar as presented. We will move on now to regular agenda items. And the first item on that is Community Development Agency, Greg Gatzka and Chuck Kinney. Good morning.
Can you hear me now, Chairman?
Yes, sir.
Good morning, Chairman, members of the board. Greg Gatzka, Community Development Agency Director, here to give you an update on the Planning Commission's actions. They held a special meeting yesterday. It was the regular date, but because of the changes with COVID, we had to hold a meeting in the earlier time frame to accommodate some of our Planning Commission members. So we did have 3 in attendance yesterday, and there was 2 items for their consideration. The first one actually is a conditional use permit that was previously approved in 2014, I believe. It's conditional use permit 14-01 from Westside Assets LLC, which is a commercial solar site. They were requesting a modification to their existing permit. The original one was approved on, 165 acres to generate 20 megawatt. And their request for modification was to add 21.4 acres to increase the megawatts to 22.5. So that was considered by the Planning Commission. Public hearing was held. The commission voted in favor of it, 3 in favor, and we had 2 absent. The next item that I want to bring to your attention is actually a very exciting one for us in the planning realm, because land use projects often are not fast approval processes. And here we have a very unique project that will be coming back to you as the Board of Supervisors for your final approval. And this is Jackson Ranch Specific Plan that the Planning Commission took for making recommendations to you as a board. And this is proposed by Utica JLJ LLC. And what this is if you recall, in 2010, when you adopted our general plan, one of the priorities in there was to leverage existing on-ramp, off-ramp areas along Interstate 5 and try to generate more commercial or industrial activity out there for greater sales tax, business development, and investment. This also happens to be the Federal Opportunity Zone, which provides other tax incentives to businesses that locate there. So staff has been working on some of these sites, especially on Utica and I-5 for the last several years. It's only been within the last 2 years that we've had a full development project complete with services and all the necessary things to accommodate commercial and industrial operations out there. So we've been reviewing that over the last 2 years, working out a lot of the details, and now the culmination of that has all come to the Planning Commission as of yesterday. What this includes is a specific plan that covers approximately 425 acres located on the southwest corner of Utica and I-5. And through a specific plan, a little bit different, that would create its own unique plan with its own regulations and standards for those properties to create a unique design that's attractive to the travelers and enticing to businesses. So what is proposed in this is 3 new land uses that would include commercial thoroughfare that is 27 acres, and that would be the first phase of it. 114 acres of innovation center for light industrial and commercial and other research and development opportunities. And then more than half of the site, 268, would be designated for specialty agriculture. This is very unique where we have the commercial developers that actually want to integrate a rural agricultural part of Kings County and integrate it there with ag businesses and things that are compatible with those highway commercial and industrial uses. The project would provide its own services. We've worked a lot of those details out to where they would actually be consolidating their water service with Kettleman City and bringing new water to the development site and the community, so it makes both of them sustainable. And we're having to, as staff, we also have to make some changes to the existing general plan, the development code, and the zone district boundaries. So we have recommendations of those as well, which are basically to make sure that all the documents are consistent. So what was considered by the Planning Commission was the adoption of the Jackson Ranch specific plan, also General Plan Amendment 19-01, Development Code text change 668.16, and Zone District Boundary change 20-01. To share with you, this whole entire project has been reviewed and has had an environmental impact report prepared. It also included, as a result of that, a mitigation and monitoring and reporting program. And there is also a statement of overriding considerations for 3 of the environmental impacts that are considered significant that would have to be addressed in that manner. So with that, the Planning Commission held a public hearing on this specific plan proposal. The Planning Commission voted in favor, and it was three in favor and 2 absent. So I know that's a lot of information. This item will be coming back to you for your final and formal consideration. So if there are any questions, please let me know.
Thank you, Mr. Gaska. Appreciate that. I know I went out there, Jude, it's probably been 6 years ago, met with the Jackson family that owned the property at the time and got their vision, and look forward to seeing this come together. So appreciate your hard work. Okay, this is just more on just information item, right? So thank you. Any questions for Greg? Supervisor Valley, you got anything for
no, sir,
your district?
Chair. No, I heard, and I got an update. All right, thank
Big deal. Okay, we're going to go ahead and move on now to the University of California Cooperative Extension. And this is going to be a consider adopting resolution proclaiming October 4th through the 10th as 4-H week in Kings County. And today on the line, we have Trista Fry and Julie. Hey, we have Trista on the line.
Yes, can you hear me also?
Yes, I hear somebody else.
It's your.
Who is it?
Okay. Hello, my name is Anna Dewey. I'm a member of King's Harvest 4-H team, and this is my second year in the 4-H program.
Hey, so okay. Anna, turn your volume down, please.
Is it better now?
That's a lot better. Thank you. Go ahead. Start over, please.
Okay. So, hello, I'm a member of King's Harvest 4-H, and this is my 7th year in the 4-H program, and I am one of 2 King's All-Star candidates for this year. So in the 4-H program,
Sorry. Hi, my name is Trista Fry. I'm in the Oakville 4-H Club, and this is currently my 10th year in the 4-H program, and I am the second Kings County All-Star candidate for the 2020-2021 program year.
Okay, I would like to start off by saying thank you. We really appreciate all of your support for the 4-H program. This program means a lot to me personally, and it has allowed me to find my interests, and it has also impacted what I hope to do in the future. Projects are a big part of. There's a leadership side, and there's a lot of leadership opportunities. When I started 4-H, I hated the idea of having to present something. 4-H has improved not only my speaking abilities, but it has improved me as a person. This program is amazing, not only for me and Trista, but also for the many members who participate in it. Thank you.
And this week is also the start of National 4-H Week. Even though we have had the restrictions of COVID placed upon us, we are still spreading the word by having banners hung in the towns of Hanford, Corcoran, and Lemoore. We are still having 4-H window displays and the paper clover donations at Tractor Supply. Because of this virus, we are not allowed to physically be at Tractor Supply, so we are not for sure how well the participation will be. So if you happen to stop by there, please support us. One of the events that we have been able to do virtually is to create a virtual achievement night video that our 4-H members can watch and be recognized for their hard work and achievements. We are also planning on having a virtual judging day so that we can help to keep this year as on track as possible and so we can get back to face-to-face interactions. Thank you again for your continued support of the 4-H program.
Very good. Thank you both. We can see you on our big screen. You guys look like you're right here. You guys did a wonderful job. I know 4-H is very important for our community, and I know my grandmother was a 4-H leader, and she taught sewing and home ec at our house to my aunt and her kids. And I was in 4-H a little bit. My sister was. So it teaches you life skills that you wouldn't get on your own. So thank you for supporting it, and thank you for presenting this to us today. Any other questions or comments? Nope. We have a motion to approve by Supervisor Fagundes and a second by Supervisor Neves. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Aye.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
So 5 in favor, so thank you very much. And I believe she said we go to Tractor Supply Hardware and we can support them there, okay? Yeah, you pay like $1 and they put your name on it, okay, yeah. So support your local 4-H at Tractor Supply. All right, we're gonna, item number C was pulled, Public Works was pulled, and we're gonna move on now to Public Health Department, item 1A. CareLink.
Hi, this is Nicole Fisher. Can you hear me?
Yes, Nicole, we hear you fine.
Hi, thank you. Good morning, Mr. Chairman and members of the board. Nicole Fisher, Nursing Division Manager for Public Health. I am here today to present the Valley Children's Hospital CareLink Agreement for Access to Protected Health Information agenda item. The California Children's Services, or the CCS program, provides medical case management to ensure specialized healthcare services and supplies for over 1,100 medically fragile children in Kings County enrolled in the program. A large majority of the children enrolled in the CCS program are seen for medical care at Valley Children's Hospital in various specialty departments. In order to authorize and continue to expedite services, our local CCS program and the state must review any and all supporting medical records or prescriptions. Our CCS public health nurses and children's medical service workers have previously had access to the electronic medical records at Valley Children's Hospital by individual agreement, and Valley Children's is now utilizing a different electronic record system, and access to this system will require an agreement between Valley Children's Hospital and the Kings County Department of Public Health. There is no impact to the general fund, and this has also been reviewed and approved by County Council. Our recommendation is to authorize the chairman to sign the Valley Children's Hospital CareLink Agreement for access to protected health information, and to authorize the public health director to sign the Valley Children's Hospital CareLink Agreement for access to protected health information. I'm happy to answer any questions if you have them.
Thank you, Nicole. Any question or comments? None? A motion approved by Supervisor Fagundes and a second by Supervisor Neves. Madam Clerk, please call the roll.
Supervisor Neves?
Yes.
Supervisor Valley?
Yes.
Supervisor Verboen?
Yes.
Supervisor Peterson?
Aye.
Supervisor Fagundes?
Yes.
Okay, 5 in favor. Thank you very much. We're going to move
Thank
on now on item E, administration. Rebecca Campbell.
Okay, can you hear me okay?
I hear you fine.
Great. Okay, so this is a weekly update on the COVID-19 status. Good morning, Mr. Chair, members of the board, Rebecca Campbell, County Administrative Officer. The last update that was given to your board was last week on September 29th. So I'll start by first going over any state-related items, state actions, and then I'll touch on federal actions, talk about the county, and then I'll turn it over to the Director of Public Health, Mr. Ed Hill, and he'll give a local public health update. So going back a week, the Newsom administration released details on the equity metric that have been previously referenced numerous times and have been developing since the blueprint for a safer economy was unveiled in August. Concern that certain low-income, disadvantaged communities have a higher test positivity rates. The state administration is seeking to curb disease transmission by focusing on reducing positivity in these communities. Starting on October 6th, in order to advance to the next less restrictive tier, counties with populations over 106,000 will need to meet an equity metric and demonstrate targeted investments to eliminate disparities in levels of transmission. The rules rely on test positivity rate, the percentage of positive test results divided by the number of test takers. Additionally, the California Department of Public Health is assembling a health equity technical assistance team to develop best practices, resources, and vendors with an equity focus to share and provide resources to counties. The California Department of Public Health is also coordinating regional hubs to provide resources. So Mr. Hill will give you a more detailed update on this equity metrics when he talks. This past week, the governor wrapped up signing bills and all his vetoes. He took final actions on the 2020 legislative measures when his 30-day signing period closed last Wednesday. I will be sending your board an update from ChrisCon on that. Also, the UCLA Anderson forecast released a quarterly economic forecast this week, a bit of good news, noting cautiously optimistic recovery nationally and a 2-year recovery timeframe for California. While federal employment benefits and business loans and reopening of some of the workplaces help the state's economy bounce back, a full economic recovery will take 2 years, is what they're projecting. The forecast notes that the pandemic-induced recession has impacted industries unevenly. California's leisure and hospitality industry payrolls are anticipated to drop 25%, while the housing market is anticipated to return to pre-recession levels quickly. The forecast presumes widespread availability and usage of the effective COVID vaccine by early 2021 and assumes that Congress approves a $1 trillion federal stimulus before the end of the year. Should either of both of those assumptions fail to materialize, the economic predictions are overly optimistic. Finally, the authors note that the unemployment is the major challenge to economic recovery in California and nationally, particularly for people of color and women. A few reminders on the November. I want to thank Mr. Villa for giving your board an update this morning. Vote by mail ballots were mailed out from Kings County yesterday. And so across the state, most of the ballots were mailed out yesterday. From the Secretary of State's office, Californians should take the following steps to prepare for the general election. Number 1, check your voter registration. That can be done at voterstatus.sos.ca.gov. Number 2, update your voter registration if you've moved or changed your name. That can be done at registertovote.ca.gov. And number 3, sign up for Where's My Ballot for automatic updates on the status of your vote by mail ballot. And that can be done at california.ballottracks.net/voter. Voters who sign up for Where's My Ballot will receive automatic updates when the county elections office does 4 things: when they mail the ballot, when they receive their ballot, when they count the ballot, and if there's any issues with the ballot. So it's a good thing to sign up for. The 3 major changes for all counties is that they can consolidate their precincts into voting centers as long as they have at least 1 location for every 10,000 voters, which must be open for 4 days. All counties must implement social distancing, meaning larger locations and fewer voting machines. For in-person voting, voters will experience 5 different kinds of in-person voting systems being used by counties due to COVID-19. 1, traditional polling places. 2, consolidated polling places. 3, all mail ballot. 4, consolidated polling places, which Kings County is doing. And 5, Voters' Choice Act. For consolidated polling places, for countywide voting, these are larger in-person voting locations. Similar to what we've seen in the Voters' Choice Act, these voting locations have more services and can produce a replacement ballot on demand with all the contests, and the voter is eligible to vote in. Okay, so the Department of Finance, State Department of Finance, released its first quarterly report on coronavirus relief funding expenditures required by the federal government. The state of California received $9.5 billion that was allocated. As I spoke of last week, and just as a reminder, the 3rd round of Home Key Awards were announced, and that is a $137 million investment for 19 projects in 15 communities, totaling 938 units. On the federal side, as an update here, both sides have not reached a deal yet on a stimulus package or HEROES Act for COVID-19 relief. While both sides have indicated that conversations will continue, it remains unclear if the parties will be able to reach a consensus on a COVID-19 relief package. But in the meantime, the House Democratic leaders have teed up on the floor what they are characterizing as an updated version of the $3.4 trillion House-passed HEROES Act. The new bill is H.R. 8406, which has a slimmed down price tag of roughly $2.2 trillion. It includes $436 billion in COVID-19 related fiscal relief to states and local governments. Okay. So Kings County update, our Emergency Operations Center continues to meet weekly. The county continues to take steps within its own doors to reduce any exposure to its employees and to the public. The county did receive the surgical masks that were donated from Hawaii on Friday afternoon, and the Ag Commissioner is working to get those out to different sectors within the community. We also, the administration office submitted the attestation to the State Department of Finance for the realignment backfill funding. And that's it for county side. And now I would like to turn it over to Public Director Ed Hill for a local public health update on COVID-19. Thank you.
Mr. Chairman, can I ask a question?
Yes,
before
thanks, Rebecca. Supervisor Valley's got a question for you.
Sure.
Well, it's a question. I don't know if it's exactly for her, but through you. Mr. Chair, those masks that came in, I believe they're a higher grade than the cloth masks that we're currently giving out at the mobile testing sites. Can we look in to see what the possibility is if it's a county mobile testing event, what the rules are to give away an upgraded mask? Meaning, I believe these masks that come in are more than the simple cloth mask that they're giving out, that little 5-pack. Just see what that is. That is a question to see where we're at moving forward on that. If that works, then.
Yeah, I know that Jimmy Hook took delivery of them because there are no masks in the public sector for any farmers. So all the farmers are using the mask for COVID and smoke. So I know I went with my employees. I have like 15 employees right now. There were no masks available. So I put in together a ask for masks from the smoke and COVID for my employees. So they put together a bag for me. I went and picked them up 2 weeks ago. So I know we're using them for that right now for farm workers.
Got it. I know there's levels. I know there's levels to it and different rules on the different types of masks.
You can only get it for COVID and smoke, not for dust. So your request has to be because of the smoke in the air or COVID working in close quarters.
Okay. I would just put it out there that if there is a window that allows to give an upgraded mask at Mr. Hill's events, then that's just something to look into.
Okay, thank you. Yeah, Ed Hill on that one.
Okay. And then I'd also just like to ask where Rebecca's broadcasting from, because the air quality looks beautiful. The water's dark blue, and I want to go there when this meeting's over. You never sound that nervous when you're here. Is the experience that you're doing? Because do you feel nervous? Because you sound more confident when you're on the dais. Is like the broadcast from there? Is it different for you?
Well, everything's on the screen, so it's a little different. I usually have lots of paperwork in front of me, so just trying to keep all my windows straight.
You did good. You did good.
Thank you.
It's different.
Thank you. We will certainly reach out to the Ag Commissioner and make sure that we get the masks out to the events appropriately. Thank you.
Thank you.
Thank you.
All right, Ed, are you available this morning?
I know, it looks like.
Good morning, Mr. Chairman, members of the board, Ed Hill, Public Health. Can you hear me okay?
Yes, sir.
I'd like to start my presentation, as I always do, by going over the basic practices that will protect you from the spread of communicable diseases like COVID-19, which are wash your hands frequently for 20 seconds or more. Don't touch your face with unwashed hands. Stay home if you are sick. Stay hydrated with water. And cover your face using face coverings. Again, the face covering will help you from spreading the disease. It won't stop you from getting it. As stated last week, we have updated how we present our numbers on our website. The changes are being made as our EPI team works, again, with the California Department of Public Health and aligns our systems with theirs so that we are better reporting to their standards, which is the standards that we have to live by in the county. And because of this, you're going to continue to see minor changes as we move forward, especially when we deploy our digital dashboard, which I'll get into a little bit later on. And then again, we've also started updating our website at 10 in the morning each morning instead of in the evenings. Again, it's just as we align the data polls and the reporting closer to the state. Our current numbers, we've currently tested 53,720 times in the county. We currently have 241 results pending. We're currently monitoring 1,558 individuals. Current total cases for the community, this is new cases, 4,390, with unfortunately 74 deaths. Our total recovered so far are 3,713, with 603 active cases. Our skilled nursing facilities in the county remain the same at 173 total cases since the outbreak began. They currently have 15 active with 134 recovered and unfortunately 24 deaths. Those 24 deaths that I just reported are also included in the number I gave before of 74. That's 50 community and 24 associated to the skilled nursing facilities. Our state prison outbreak, current total cases since the outbreak began is 3,535. That's 426 at Corcoran, 2,957 at ASP, and 365 at SATF. They have tested 32,989 times. They have 88 results pending. Active cases are at 961. Recovered are at 2,566, and unfortunately with 8 deaths. They currently have 2 individuals hospitalized, one here in Hanford and one in Bakersfield. We continue to watch the prisons very closely. As I've stressed before in the past, our concerns are a possible healthcare surge in our system, and we continue to work and hold calls with CDCR in the state on this topic on a regular basis. We also continue to watch hospital data closely, both on a regional and a local level. We have seen a decrease in hospitalizations, both locally and regionally, and this is good news as we prepare for the flu season. As of yesterday, the local hospital had 15 COVID patients, with 1 in the ICU. 5 of those individuals were Kings County residents. The rest were from outside the county. The hospital also reported that they have demobilized their command center, and it's currently deactivated, but it is in a ready state and can stand back up if there is another surge. The Porterville Development Center remains in a warm state, meaning that it is empty, but they can also stand that up within 72 hours in case there's a surge of patients, COVID patients within the counties of the region. We are currently still maintaining a 60-day supply of PPE for all of our healthcare providers. That's the full PPE gambit, which includes gowns, N95 masks, and gloves. Our testing unit was scheduled at the Kings County complex yesterday. Today it is over in East Hanford. Wednesday it'll be at Avenel High School. Thursday, Lemoore High School. Off on Friday. And Saturday it'll be at Daniel Salas Harvesting. And then Sunday it'll be at the city of Corcoran. We have begun to do flu shots and back-to-school immunizations. They're being done in conjunction with the mobile unit at certain sites, as well as by appointment here. We were able to administer 141 flu shots yesterday in conjunction with the unit. And then we are also taking appointments again for back-to-school immunizations. We're in the city of Corcoran today doing flu shots at our clinic, as well as back-to-school immunizations there. I would like to once again thank your board for approving the waiving of the administration fee so that we can provide that flu vaccine free of charge and distribute as many as we can this year, especially amidst the COVID pandemic. Our EPI team continued to work with the state EPI team and align all of our systems and data and processes. This includes acquiring the code to run the data and again to try and match the states as much as possible. But again, I want to reinforce that we will never get the numbers exactly as the state does. We are not the only one that is in that situation. The rest of the counties are as well. As a reminder, that variability exists because of the time the data is pulled, how many are electronically entered as labs, and how many are manually entered. Again, I want to thank County Council for pushing through the agreements that we needed to acquire the systems necessary for this team to get to work. They have created a draft digital dashboard. I reviewed it late last night, and then this morning, and just this morning, I sent it over to the CAO for review, so hopefully we'll have a digital dashboard up on our website soon. Our program that is designed to support the essential workforce and their isolation and quarantine needs continues to run. They are currently serving 10 households. We have created additional advertising for this service, and we're deploying it with all of our testing sites and throughout all the testing sites in the county. We may be modifying this program to expand its scope depending on what we learn from our focus efforts in the parts of the county, which I'll get into a little bit later on. We continue to hold regularly scheduled follow-up calls with the State Unified Support Team and continue to work through any pending issues as well as any new items that arise. One of the biggest issues that has recently arose is I'm going to get into our positivity and new cases numbers a little bit later on. They are looking better, so the state is looking to take some of those resources, specifically in the form of contact tracers and case investigators, move them to other areas. We are asking them not to do that. Again, I'll get into this a little bit later on as to why we would like those resources to stay. We're also gearing up for the possible release of the COVID vaccine, and the California Department of Public Health is holding regular calls with the local health jurisdictions to plan for this distribution and prioritization of these vaccines. I will continue to update your board as we learn more. Last week, we spent a great deal of time on the new equity metric that is being rolled out by the state this week. It is anticipated that they will release the data on this metric today along with their normal data release. The metric is somewhat complicated, so again, I'm going to do my best to explain it here today. Counties will now be held to 3 standards. The first 2 standards are not new, and they include the new cases per 100,000 of the population. In order to move to the next tier, these numbers need to be less than or equal to 7 per 100,000 to move to the red, less than 4 to move to the orange, and less than 1 or equal to 1 to move to the yellow. The second standard, which is also not a new standard, is testing positivity, and this has not changed. It has to be less than 8% to move to the red, less than 5% to move to the orange, and less than 2% to move to the yellow. The third and new standard is a health equity metric. This metric is based on the lowest scoring census tracts, or the first quartile, or the first 25% of the Healthy Places Index. This metric will not be used to move a county backwards, but counties do have to focus their efforts on these low census tracts, especially their ELC CARES Act funds. We have to make sure that these funds are concentrating on these areas. The testing positivity must meet the identical colored tier status to move to the next tier. So, for example, if our overall county testing positivity is less than 8%, but the average testing possibility or positivity for these census tracts are greater than 8%, the county cannot move to the new tier. This metric does, however, provide the county with the opportunity to move up a tier if the testing positivity for both the overall county and the lowest HPI scores are in a range that is 2 tiers less restrictive than the current tier. For example, if our testing positivity is less than 5% or the orange tier requirement, and the lowest 25% of the HPI is also less than 5%, we will be eligible to move to the red tier regardless of our new cases per 100,000. So it does give us the ability to spring forward. We currently remain in the purple tier. Our numbers for last week were, our new cases per 100,000 was 8.5, but because we tested more than the state's median, we were given credit and our score was adjusted to 7.2, and our testing positivity was at 4.1%. Additionally, our testing positivity for the lowest HPI scores was at 5.6%, which is only 0.6 away from having both of our testing positivity numbers in the orange or tier 3, which again, if we can maintain that, would give us the ability to move to the red tier regardless of our new cases per 100,000 number. We spent the latter part of last week and the weekend identifying all of the census tracts in the 0 to 25% range of the Healthy Place Index, then calculating the positivity rates for each census tract so we can concentrate our efforts in these areas. We have modified our action plan to focus on these areas, which is also a new requirement by the state for moving between tiers. Another category the state will be watching is the completeness of data statewide. The state indicated that to date, approximately a third of the cases and up to half of the test results reported in the state database don't have the required race and ethnicity data. The state will provide county-level data on the completeness of tests and cases and will continue to track and publicly post the county-level data moving forward. When we looked at our numbers, we're only missing race and ethnicity in 15% of our data, which is much better in comparison to the rest of the state, or as the state reported. And essentially, the state will be publishing this to GILT compliance statewide. And if they don't see better compliance, I'm anticipating that they will likely introduce a new metric associated with the completeness of data moving forward. There are inherent issues with the new metrics, which are, it is difficult to calculate, and we will have to work hard with the state to ensure that it's being calculated and quickly address any growth variations between our calculations and theirs. The state has not provided the locals with a true understanding of how they will be calculating the HPI testing positivity. When we calculated our own, we came up with the exact same number the state did of 5.6%, but as I'd mentioned, this is probably pure luck, as other counties have not been able to calculate this value and match the state's calculations. Also, the completeness of data will continue to be a challenge for several reasons. This will require us, public health, to become more aggressive with local agencies who are testing, such as doctors' offices, hospitals, clinics, pharmacies, to ensure that they're completing the information. And it's going to be a very heavy lift on us. It's going to be a lot of work constantly communicating with these providers. Local health jurisdictions have always struggled with this, even when we were not in a pandemic, and it's not a Kings County unique problem, it's a statewide problem. Also, as we have learned, typically the less intrusive we are with our questions, the more testing we can complete. And this is because of the fear factor and distrust of government and all of the populations. And because of this, we're going to have to increase our outreach through sources within the county, which are considered more trusting to make sure that it's understood that the data is not only helpful, but it's a requirement of the state moving forward. But to put it simply, the way we get out of this and move faster through the tiers is through testing. The state will give us credit and decrease our new cases per 100,000 if we continue to test more than the state median. And the more asymptomatic people we test, the lower our positivity rate will be. Preliminary data for the state indicates that when they release the weekly numbers today, our new cases per 100,000 will be at 3.8, and our overall testing positivity will be at 3%, and the health equity testing positivity will be at 4.4. What that means is if we can maintain these numbers and there are no outbreaks, we may be able to move to the red tier very soon. So our numbers are looking very good. I just need to start throwing out caveats here, because when we are able to open, we will continue to have to continue this testing process, because if our adjusted case rate and our testing positivity falls within a more restrictive tier for 2 consecutive weeks, but I need to be clear, not the equity metric, we will have to revert back to a more restrictive tier. There are currently some counties that have been moved to a less restrictive tier that are now facing the fear of having to move back to a more restrictive tier, because when they opened, people went crazy and moved quickly. So moving forward, we're going to be monitoring the census tract positivity rates on a regular basis. We will focus a good deal of our attention on census tracts with the testing positivity of greater than 5% and or testing positivity trend lines with a value of M greater than a negative 0.1% are showing an increased trend over the past 7 days. To interpret that or translate that, what we're saying is if the trend line of the positivity data is flat, we will begin focusing or increasing where we focus on that area. This additional attention will come, and the focus will be focused on additional campaigns, educational campaigns, testing, case investigations, contact tracing, and other support. We will begin this process by informing each respective board member and applicable city council member and enlisting their help in gaining and engaging community leadership and partners in this and throughout the process. We'll also develop strategies by engaging individuals that currently live in these censuses that have been sick, and we will use them to help us identify any barriers or gaps that exist in their respective areas, and we'll make adjustments to those gaps moving forward. This includes deploying additional testing through the public health department, and as our lab capacity increases, focusing that increased capacity in those areas as dictated by the mandate by the state. This also includes evaluating existing programs designed to support isolation and quarantine and possibly expanding the eligibility of these criteria if needed. Since the population in each of these census tracts is relatively low, we will not be releasing any positivity rates for each respective census tract publicly. We are fortunate that currently the majority of all of our census tract positivity rates are decreasing, and we only have 5 census tracts that are testing, or where the testing positivity rate is greater than 5%. Of the remaining census tract, only 3 have flat or slow decreasing positivity rates, and again, we'll be focusing our attention on those census tracts as well. Now, I need to be clear that even though our numbers are looking good right now, the more we open, the greater chance for the spread of the virus. Additionally, in order for our schools to open, we have to meet that requirement for the red tier, or tier 2, for 2 consecutive weeks. And finally, I need to remind everyone that this is COVID-19 and everything continues to change hourly, so there's no guarantee that things won't go back the way they were. There are already several counties, as mentioned earlier, that are that are in the red tier that may have to move back to purple because of changes in their case numbers and positivity. That concludes my report, and I'm happy to answer any questions.
Thank you, Ed. Any questions or comments for Ed? Supervisor Valley?
Yes, Mr. Chair. Hey, thank you for that excellent report, Mr. Hill. The flu clinic in Corcoran today, is that drive-through, or do we have to go inside of the building to get the flu shot?
That is being held at our public health clinic. We stood that clinic up today after several requests from Corcoran residents, as well as the back-to-school immunizations. So to answer your question, you would have to go in.
Okay.
Yesterday it was here and it was just tents outside and it had a line, like 20 people in line going in and getting tested.
Okay. I want to go to one that's outside. Yeah. Okay. That's all I have for now. Thank you, Mr. Chair.
Any other questions?
Supervisor Valley, through the chair, we can publish the flu clinic schedule. Actually, it is already online, and we'll definitely continue to offer it outside along the other testing options.
Very good.
Thank you, sir.
Ed, thank you. That was a good report. I'm glad to see that our testing's paying off. I think I got tested for the fourth time yesterday in the last, I think we're third or fourth week now doing it. So if we get the word out, just continually remind people to get tested every week if they could and keep the numbers down so we can open up and not lose our mind when we do open up, that everybody doesn't bum rush all the restaurants and cause a problem. So I think it's important that we, keep our cool. Supervisor Valley.
Yeah, Mr. Chair, yeah, you just reminded me. So I did test again on Saturday as well, and I'm waiting for my email. I did want to just comment that, as we are working on these numbers, that anything we can do for the general public to continue to get the word out, especially on something as simple as masking up. I know we have our campaign out. A number of folks have talked about the commercial that's running on Comcast. I believe that is helping to reach at least some folks, a few more folks to mask up. But this Mask Up Central Valley project we had with the $100 Visa gift cards, I had 3 to give away in Corcoran, and I wanted to get them done this past Saturday, and I did. But I had to drive up and down this main street a number of times just to find someone who was wearing their mask so I could flip a U and go give them $100 and go through the proper procedures that were outlined on the Mask Up program. But that was a frustration. I'm driving around going, whoa, $300 to give away. In Home Garden, I went to the community store. I walked inside. I saw a number of folks wearing their mask inside the deli, and that was easy to do. But that is that's still a challenge. Some people just still don't want to do it, and we got to get past the politics of that, the imaging of that. Yesterday at the sheriff's event, when I went up to speak, I felt something was weird when I was talking. Because this is my first time, right, since March. So I'm at the podium and I'm talking and I'm thinking to myself, what's weird here? And then right when I sat down, I realized I didn't take off my mask when I was at the microphone, because I'm used to it. I'm used to it from the fact of being comfortable with it. And I think that if we get there, and for those who believe in science and data, yeah, we could talk about this vaccine, but the top medical officials have said this little thing right here is way more protective and better than any vaccine will ever be. And I'm pointing to the mask for whoever can't see me on camera. But so it's about who believes that and who doesn't. And I know we're all individuals and we have different beliefs we got to respect. But hey, man, I'm not a scientist and I'm not a doctor, and I'm listening to those folks. And I think the board, by having our masking campaign and what we invested in that to put out there, I got to believe that, we're all trying to do the right thing. And I hope that the people of the Gig County of Kings can just see that and help us to work our way out of it, because we could be here, we're working hard, and sometimes it's frustrating. And then I leave here and I see the general public and I think to myself, is it worth it? Like here we are, everything we're doing is sometimes negative energy, and I leave here and I get out there and I'm like, I was just fighting for you people, and you don't even, and do you not even care? And that part right there is sad, Mr. Chair. That's hard right there.
Well, I drove across country this summer 4 times to see my dad, and one community I noticed that depended on tourism, they had mandatory masks at all times, and it was enforced. And everybody wore masks. No one complained because they were out and they're doing their own thing. So I think if we want our freedom, we got to continue to follow the protocols and wear a mask and around other people. So I know I found 5 or 6 individuals. I gave it to Heather Silva at the health department, and these are the 5 people that were practicing what we preached when it comes to wearing a mask, and they were promoting it. So I made sure that they were rewarded for it.
It's, and to your point that, man, when you're somewhere nice and beautiful, I'm not saying Kings County is not beautiful, but let me rephrase that. When you're somewhere away from home, because when you're home, we're all locked in normal in this vision of what normal life is. But I mean, I've experienced just walking on the beautiful beach of Pismo at least 6 times to go get exercise and walk down the pier all the way up, feet in the water, and my mask is on. And so's the majority of the people who are doing that. And someone comes running behind me, jogging, passing me up, and they got their mask on. And so the point is, like, you could be out there, beautiful, clear blue sky at the ocean, and people are not fighting with each other. They're not arguing with each other. They're saying, I'm happy to be out here. I got my mask on. And when no one's around, guess what? Take it off, sit down on your beach towel, relax. Someone comes by, the respect, you see people showing they mask up. And I do the same thing too. When I take mine off and someone walks by, I put it on.
Oh, thank you. Ed, you have your hand up?
Yes, thank you, Mr. Chair. I just want to reinforce, in case I didn't say it enough, I'm going to harken back to when we submitted our attestation. Our numbers looked good at that time. We opened, and then the numbers, not only in Kings County, but throughout the valley, took off and throughout the state. Again, it's good to learn from your mistakes. It's better to learn from others. We've seen other counties, as I mentioned in my report, that were able to move to the red tier. And then because of the free ability to move and the businesses opening and the ability to get out more, people do what people do, and they flooded those areas, and now they're seeing a spike in those areas. So even though we're going to have that ability, it's still going to be very important for all of us in the county to continue the testing, because again, that is what's driving these numbers down, as well as helping us understand and focus our efforts moving forward. So I just wanted to reinforce that again.
Thank you. Okay, any further questions or comments? We'll go ahead and move on to, we got to go back to the consent calendar. We have a correction to make, and I think Lee Burdick's going to address that.
I will introduce it, Mr. Chair. Going back to consent calendar, item number 4 on the agenda, sub-item D from the Public Works Department. I understand the number of vehicles that the department hoped would be declared surplus has changed. I'll allow Public Works Director Kevin McAllister to explain, and then we'll need to check in with Supervisor Neves and Supervisor Peterson to see if the change in the information would in any way change the motion to approve the consent agenda.
Okay. Kevin, you're on the line?
Good morning. This is Kevin. Can you hear me, Mr. Chairman?
Yes, sir. Hear you loud and clear.
Okay. I apologize for this error. It has to do with an embedded spreadsheet in a Word document. There were 5 vehicles that were inadvertently left off of the printed version that you received. You would see them in your electronic copy, but not in the printed version. There are, like I said, 5 vehicles. 2 of them are Crown Vics, which are being replaced for age and mileage. 2 are Dodge Chargers being replaced for age and mileage. And the third is a Dodge Charger with 170,000 miles that has front suspension problems that cannot be repaired. And I would request that those 5 vehicles be added to the list.
Thank you. Supervisor Neves, how do you feel about that? You good?
Yeah, I have the electronic.
Yeah. Okay, we didn't get the paper one till today. So, okay, you seconded that one, yeah? So we're good? Everybody good? Okay, everything's good. Okay, we're going to go on now to board member correspondence and board member announcements. And Supervisor Valley, you want to start it off?
Sure, Mr. Chair. Let me look at my notes real quick. Yes, Mr. Chair. So last Wednesday, back here at the County Government Center, I met with several representatives from American Ambulance to talk about, they reached out to me for a meeting to cover an old concern that I had brought up publicly about 2 years ago. So we had that talk. I also want to report I had a good call with Lupe Villa, Department of Elections, regarding something that he did a very good job of clearing up as it relates to the drop-off mailboxes that are being put in our communities. The groundbreaking yesterday, that was a very nice event. And again, congratulations to Sheriff Robinson and the outstanding work that he did, and the teamwork, the credit to teamwork, Assemblymember Salas, our Board of Supervisors, and the Criscom Company for going back and getting these monies for the county that helped make yesterday a reality. And a reminder that that larger part of money went to good use in the city of Avenel and the city of Corcoran, and the new Corcoran police station we have there as well. So that felt very good to be at an event and break ground yesterday, be around something very, very positive. Yeah, and Lemoore as well. And thank you, Mr. Chairman, for being there and speaking yesterday as well. And I already reported that I tested on Saturday, and I reported that the Mask Up Central Valley project, overall, it was fun. It was a feel good to go up to people. And the number one reason when you ask people before you offer them the money, you ask them, can I ask you why you're wearing a mask? I noticed that you're wearing your mask here. Do you mind if I ask you why? The number one reason was because I love myself and I love my community, and I respect myself and I respect my community. And then I'd ask them if it'd be okay if I could present them with the $100 gift card. They were very happy. And then we take the socially distant selfie. So all of this I turned into Heather Silva through email. She has all that documented, everything we got asked to fill out, and the selfies. So I think that is all that I have. Thank you, Mr. Chair.
Thank you. Supervisor Peterson.
Yeah, thank you, Mr. Chair. Not a lot to report, but a couple of interactions with staff that were really timely. On Friday, a constituent reached out to me, had a friend that's homeless, has an addiction issue, and as you know, with addiction, there's a moment in time when someone's ready for help, and it just happened to be that time. Reach out to or shout out to Sonia and Isam Abed, assisted in getting this person out of homelessness and into a facility that he can receive treatment, and hope that goes well. Same thing with Lisa Lewis. Over the past couple months, a couple of folks have reached out, and again, it's all about timing and getting someone help, and they have to be ready for that help. And so to both of them, thank you for your services and taking care of the community. That's it.
Good. Much for goodness.
Not much this week. We had Supervisor Nerva and myself had the housing or waste management, housing authority, and the rest of the group also. And then on Sunday, we've done a drive-through takeout dinner for MIQ school. So
Did they all wear masks?
Pardon?
Did they all wear masks?
Nope.
Supervisor Nez.
Thank you, Mr. Chair. I attended the Kings Waste and Recycling meeting as well, and there will also be a tour of the Mid-Valley Materials Recovery Plant in Fresno on a week from tomorrow, October 14th, 9 a.m. I want to see how the blue can material gets collected and then shipped to Fresno and then sorted. Also attended virtually California Behavioral Health Board's. One thing about this event is I would have never attended many of these conferences and many of these trainings, but online it's much easier to do. And so that was a statewide conference regarding oversight, accountability, and kind of an evaluation of telemedicine in regards to behavioral health. At Calviva, we've also found that telemedicine has not been well accepted. It's gaining in popularity, but I was kind of surprised because most of the time healthcare access to healthcare has been a problem because of transportation and everything else. And now you have an opportunity where telemedicine is available, and there's less than 15% of the people taking advantage of it. But it seems like that trend is changing, and there is some movement. We're just trying to figure out why people don't take more advantage of the telemedicine.
Sometimes they just need a hug.
Yeah, yeah, and there must, so yeah, we'll have to, we're not the only
I'll give you a hug. I'll give you a hug.
Yeah, thanks. Put on your mask. The other webinar that I attended had to do with human resources and teleconferencing as well as emerging needs. I know we are seeing it both in the van pool program as well as CART. Teleworking has changed many things as far as flexible hours, home-based needs for family care, healthy environments, technology challenges, and so it's just changing the way everybody is doing business. And I think Rebecca talked about, some of these incidents will probably continue for at least a couple of years, and a couple of the speakers didn't think that they would ever go back. Some businesses are working very well with 2 days in the office and 3 days teleworking, and it's cutting down on their commute times. It's cutting down on their parking needs. It's cutting down on their janitorial services. It's allowing them to do maintenance and sanitation and everything else that they need to do with the staggered and flexible shift work. So I think mass transit as well as van pool programs are probably going to have to shift to that. And a lot of the van programs that we have now, especially if they're going to a bricks and mortar, we're not seeing it in the ag side, but a lot of the Chevron and large corporations, you've been seeing some dramatic shifts because that employee is only going to that office 2 or 3 days a week, and then the rest of the time they're doing their 40-hour work week at home or through the teleconference situation. So, kind of an interesting webinar to attend, and for businesses, it means they're shutting down offices and turning leases back, and unfortunately, that's not good for the landlord that has that building that relies on that lease, but it apparently is working good for many of the employees. Before COVID, it was less than 5% of the people that worked teleconferencing. Today, they felt that 49 or 50% of the folks that were capable of teleconferencing are teleworking are taking advantage of that. With that, thank you, Mr. Chair.
Thank you. I know one of my daughters lives at home, and she's pretty social when it comes to hanging out with friends, and now her friends are all over the place. So every Wednesday night they have a Zoom meeting, and then they also have a book they're reading, and they have to watch a video, then they discuss it every Wednesday night. So it's a different way than hanging out and doing what they do, but I think things are changing. 20 years ago, I went to my father-in-law's house in Texas, and he was an inventor at National Semiconductor, and he kept talking about this blue thing that was going to run your sprinklers and dishwashers and everything. I'm like, what? I don't understand. And I fully understand today.
Yeah.
That the technology took 20 years to develop or longer, and we're using it like it's every day. It's easy. We expect it to work. So as technology improves, our lives will change. Hopefully it gets better. Last week, I did the San Joaquin Valley Water Infrastructure Authority. So that was the one that used to be called Temperance Flat JPA. We still do it today. We don't fund it. We just have it, Fresno County manage it for us. I'm vice chair on it with Buddy Mendez as chair. And we went over our new bylaws to change it because we handed over the $174 million over to the Temperance Flat JPA. And we're still having it. We're do about 4 meetings a year. We may do a little bit of funding to keep, to offset some of the costs that Fresno County does. We're still trying to get some of that money back to use that money for that reason. So we're still working on that right now. Harvest, and we're in full swing of walnut harvest and almond harvest and pistachio harvest right now. Hopefully we'll be done here in about 2 or 3 weeks. And met with Ed Hill on Saturday with a Zoom meeting with Rebecca Campbell, talked about our matrix and our dashboard. and where we're going and what we're doing, how things are working and not working. So that worked out pretty good. And then I want to congratulate Sheriff Robinson and thank Supervisor Valley for his efforts to help get the funding along with Rudy Solis. I mean, that was a big reach to get that kind of money from that area of the government. And to do that, kind of opened the eyes up to other communities around us. So the sheriff could get that building built with that money, and the board for helping him build to his liking is a good deal too. So that's a great deal. You think about it in the last 10 years, what we've done as a board with our sheriff. We've done more in the last 10 years than anybody's ever done in any part of the sheriff's department or the board of the county. So should congratulate yourselves on that too. So appreciate that. What we got now? Okay, now we got board correspondence. So Rebecca Campbell, are you there?
I'm still here. Can you hear me okay?
Yep, we hear you.
Okay, we don't have any updates in correspondence this week. Upcoming meetings, we have through the Greater Chamber, we have the Public Safety Appreciation Lunch on October 23rd. The general election, as we spoke about, is Tuesday, November 3rd. And the CSAC annual meeting will be a virtual event this year. That will be beginning on November 12th through the 19th. Upcoming agenda items, we'll have the COVID-19 update next week. We'll also put on, as you requested, the elections update. From the County Council and Ag Commissioner, they will bring the hemp ordinance to establish new regulations for the industrial hemp cultivation period. From Public Works, there'll be an in lieu parcel map dedication from the Sheriff's Office. Next week, there'll be a grant agreement with the California Department of Parks and Recreation for boating safety and enforcement of their equipment. Next week, the Fire will bring an addendum to the Corcoran Fire Services Agreement. Also from Health, there'll be a fiscal year 2021 maternal child adolescent health agreement funding application. And in 2 weeks from Health, the agreement for emergency medical services provider for emergency ambulance and paramedic support will come before your board. And that's all for upcoming items.
Mr. Chair, can I add something here for the board to consider or for the CAO to consider on her own? Mr. Chair, could we take a look at the, when we're going to talk upcoming and especially on, how we're talking about getting the community more involved and the transparency of information, can the CAO please consider changing the standard language that we've had since March here? Like, for instance, today under item E, where it's item 1, then A and B. I think that it will help get information to the community or someone to tune in of interest if we now just be more specific. Like, what are we going to talk about that day, right? If there is something that the board starts to move forward with, specifically any plan, we put that out, we agendize it. And I get that early on, we had the ability to move like this, and we needed to because the panic of the pandemic, and everyone got to do this at the highest levels of government. But I really think now it works to our disadvantage if we don't put specifically, because like even today, there was good information, but people are missing out on it because they're not seeing that this is what the board is going to talk about. And so I think it helps with transparency. 2, it lets the public know that a certain specific item will be discussed. And 3, that certain specific presentations are coming out. So
I can address that a little bit. So Thursday, the agenda goes out. Saturday, for 2 hours, Rebecca, Ed, and myself were on a Zoom call discussing what he was going to discuss today. So he didn't know what he was going to discuss today on Thursday. He only came up with it on Saturday, and I believe they worked together on Sunday and yesterday to present today. As it changes, I mean, the governor announces at noon on Monday. Things change. I mean, I can guarantee what he talked about today, he will change it big time by Monday. And it depends on how our numbers come back.
Yeah.
So I agree with you. It would be nice for people to understand exactly what we're talking about, but we are talking about.
I guess, and I agree with you there too, and that's why it's legal to do this. But if for things that we do know in advance, and there have been some that we do know in advance, if we could just start now, putting it on agenda to consider. So I would leave that up to the discretion of the CAO, whoever else that is writing the agendas, and Ed Hill too. But if there is an opportunity that's timely, yes, sir. And then if not, I get it, because you're right. Things change hour to hour. Thank you, Mr. Chair.
It'd be nice if we didn't have to talk about it. It'd be all over.
Yeah.
Thank you. Appreciate that, sir.
If your board would like, we can put some more, if we have information by Friday morning or Thursday, we can put some more information in the background on events for that week or something like that, if that would be helpful.
Mr. Chair, it is completely consistent and I would say more consistent with the Brown Act to provide exactly the kind of detail that Supervisor Valley is requesting. We can also maintain some of the language in the current agenda notice that keeps it general enough that in an emergency situation, post-agenda posting, the board would still have discretion to act on matters that arose given the emergent nature of the COVID pandemic. So we can do both.
Okay, thank you. That's very good. I know it's more work for Ed because it's changing so much, and it's hard to come together, especially when you're not supposed to be in public person. You got to be on Zoom. So I know our little 20-minute meeting turned into almost 2 hours on Saturday. So very informative.
Also, a couple other things, Mr. Chair. October is normally Breast Cancer Awareness Month, but many events are closed down. So I would like to see that, as well as emergency earthquake preparedness. There seems to be a worldwide interest in that. And so October is going to be when they have a worldwide earthquake preparedness drill. And so I'd like to kind of see that added as well as promoted. We do have a tendency to have earthquakes in California, but not to the extent that they do in some other areas, and tsunamis and all of the other things associated with earthquakes. But it'd be just kind of nice to be a part of that program as well.
Well, go to practice. You got to go in your house and run outside real fast.
Go, yeah. Jump in the bathtub or something. Yeah. Duck cover and hide or whatever it is. You know, they try to change that up.
About a year and a half ago at New Year's, we had a bunch.
Correct.
Yeah.
And the 4th of July was the Rich Grassland a year ago. So no, we've had some pretty good shakers. We're fortunate enough to not have a whole lot of damage. But you know, it is good to kind of be in the mindset. Many of those preparednesses have changed. In the past, we always told people to have enough stuff for 3 days. Now we're telling everybody to have enough stuff for 5 to be self-sufficient. And so those are all good, important lessons to be ready, whether it's an earthquake, power outage, or you know, any kind of catastrophe that might prevent you from traveling.
I agree to all those points, especially in it's 2020 and everything's happening right now. And the other point that you said too is, I think with the pandemic and early on, when you can't get toilet paper, you can't get bottled water, and we're walking into Costco and people are saying, oh, you can only take one of these. And that changed like the way I live. I never kept nothing in the pantry. Now you come to my pantry and it's like a mini Costco, from toilet paper to everything. And I never did that. Not even like a can of corn. I like to eat fresh and go to the store that day when I'm going to do. But that changed a lot of people, and that could be helpful with the earthquake too.
Yeah. And there's a lot of good programs. I can't remember if it's next week or the week after, the 14th to the 20th, or I forget the dates, but staff can do a little bit of research and just make that part of the agenda at some time in the future.
Let's remember, spam and sardines last forever.
Spam and sardines. Yep.
So, Mr. Chair, members of the board, so is it the board's consensus that the board would like to see 2 items come back? One on the October Breast Cancer Awareness Month, and also one on earthquake preparedness.
Yes.
And Links for Life and many of the other great organizations that normally have fundraisers this month are not able to do that because of COVID, so just trying to keep them, they're always looking for money. So that's what they do in order to provide services. So with that, thank you, Mr. Chair.
Okay, thank you. Is that it, Rebecca? That's all you got?
That's it for today. Thank you.
Okay, we have to be back here at 11 o'clock, so we will adjourn this meeting right now and be back at a regular meeting on October 13th, 9 a.m. And we have a council meeting at 11 o'clock. So thank you. This meeting is adjourned. Good morning. Today is Tuesday, October 6th, 2020. This is a regular meeting of the California Community Housing Agency. Madam Clerk, please call the roll.
Joe Nevs.
Here.
Richard Valley.
Here.
Doug Verboon.
Here.
Craig Peterson.
Here.
Richard Fagundes.
All 5 members
Here.
present. We are ready to conduct business today. And first item on the agenda is approval of minutes from September 8th, 2020.
So moved.
Moved by Supervisor Peterson, second by Supervisor Neves. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley.
Here.
Doug Verboon.
Here.
And Craig Peterson.
Aye.
Richard Fagundes.
I'll have to abstain. I wasn't here last time.
So 4 in favor, 1 abstention, and item has passed. Next item will be consent calendar. Item A, consider and approving the BLX group for providing continuing disclosure and arbitrage rebate services for agency and regarding to Astor.
Move as printed, not as pronounced.
Yep, I hesitated. Moved by Supervisor Neves, second by Supervisor Peterson. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley. Doug Verboon.
Aye.
Craig Peterson.
Aye.
Richard Fagundes.
5 in
I'll
favor.
abstain myself, though, right?
No, this is-
I don't?
Oh, this is new business
Okay.
consent agenda?
Aye.
So 5 in favor, and arbitrage is correct pronunciation, right? Yeah. I just had to think about it for a minute.
That's
Uh,
arbitrary, Mr. Chairman.
What's that?
It's a bit arbitrary, don't you think?
Anyway, item B. Consideration of approving resolution 20-04C, designated agent and agreement, appointing GPM Municipal Advisors LLC as designated agent for the agency in relation to Astor Asset Ownership Project. Any questions?
Mr. Chair, I understood the previous motion to address both items on the consent agenda.
Okay, I read them both.
It's all good.
After, so sorry about that. We're gonna go on to new business. A, consideration of approving resolution 20-04A, Astor, City of Dublin, County of Alameda, California, authorize acquisitions of and ownership of multifamily rental housing facility and issue an amount not to exceed $210 million in revenue bonds. Staff, Scott Carper. I think Scott's on the line today. Morning, Scott. There you go. Yep, you turn the sound down.
Burglar alarm.
The echo.
Right.
Can you guys hear me?
Yeah, you gotta turn one of your devices off.
Just turn it down.
Or down.
How's that?
Not good.
You're still echoing pretty good.
Maybe I'll try, let me try calling from my cell phone.
Okay.
Wow.
Sounds like a movie. Friday the 13th.
Scott, try speaking now.
Can you hear me now?
Yes.
Sound good.
Oh, you guys can. Okay, cool. I was just gonna call it for myself. All right, so as long as you guys can hear me. So again, this is for the Astor Apartments. Calcha's got its 5th deal before you guys today. So Astor is a 313 unit multifamily rental housing facility. It's located in the city of Dublin. Currently, right now, this is a 100% market rate rental community. This is walking distance to the Dublin BART station. It's close to a lot of retail shopping. It's got a great location there in downtown Dublin. Again, Couch is being asked to consider the issuance of up to $210 million of governmental purpose bonds for the acquisition of the project. Upon acquisition, Couch is going to enter into a property management agreement with FPI for the day-to-day property management operations. We're also going to concurrently enter into an agreement with Catalyst Housing Group. I want to walk you guys through something here. Catalyst, so the city of Dublin joined Calcha as an additional member about a month ago.
And in doing so, even though they're joining as an additional member, and again, they have no liability, they still were looking for an extra layer of indemnification from Caltra. And again, us being a governmental entity, we were not going to give that to them. However, they decided that they would accept an additional indemnification from our asset manager and project administrator, the Catalyst Housing Group. So for this transaction and this transaction only, Catalyst has set up a special purpose entity called Catalyst Dublin LLC. And they will be acting as the project administrator for this project and also indemnifying the city of Dublin. So Caltra is going to enter into this project administrator agreement with them. Catalyst is going to guarantee Catalyst Dublin's performance under the project administration agreement. So we do have a separate guarantee agreement with Catalyst Housing Group, the parent, since they set up a special purpose entity. So just want to let you guys know we have all the same protections and indemnities that we have on the other transactions. So the project public benefits here, again, these units will become income and rent restricted throughout the duration of Caltra's ownership to ensure that the project's affordability to households earning 80 to 120% of AMI. We're also going to adopt a non-displacement policy for all existing project residents to remain in their units as long as they wish. And then just like we have done in all the other projects, Caltra will grant all excess project revenues to the underlying jurisdiction, which in this case obviously is City of Dublin, through a purchase option agreement that will be executed at the closing. Financing structure here, you guys, this is really the same as all the other deals. We are going to have the extraordinary expense fund again for any additional costs outside the authority. The finance team here is the same. We have Oric as bond counsel. We got GPM as a designated agent. We have Widra Soar, our insurance consultant. They reviewed everything and have signed off. There is one thing I want to bring to you guys' attention. This project that we're acquiring was on an old car dealership site years and years and years ago. So there was some contamination in the soil as well as the water. So when this project was developed, they had to put in a vapor mitigation system to obviously track and get out a lot of that contaminated soil and water. So that system is monitored by Alameda County. So we have annual reporting requirements to maintain that vapor mitigation system. I want you guys to know the whole group is signed off on all the environmental issues at the property. Our insurance consultant has reviewed everything. We also are going to have a separate environmental pollution insurance policy on the project. So nothing more for you guys to do. At least want to make you guys aware. We brought in all the professionals to make sure that what we are acquiring is up to code and we're aware of all the issues. So that's all been signed off there. I think that's pretty much it. We do have our special issuer counsel on the line, Andy Phillips. Andy, can we hear you?
Yes, good morning, everybody. Can everybody hear me okay?
Yes, sir.
Okay, as Scott mentioned, there is that particular environmental concern with the property. Wanted to bring that to the board's attention today to let you know there's a continuing obligation for all property owners, current and future, to comply with the requirements that Alameda County has placed upon the property for maintenance of those mitigation measures for the environmental concern. As Scott mentioned, that has been built into the financial modeling for the property. There's an environmental consultant that's engaged and will continue with the property. And so we're aware of the issue. It's been addressed in the documents, and obviously it's a bit different than the prior transaction. So wanted to bring it to your attention. The second issue that I'd like to bring to your attention is the concept of the special purpose entity that Scott mentioned, that being Catalyst Dublin. We have an agreement in this particular transaction called a guarantee agreement, whereby Catalyst Housing is guaranteeing all obligations and performance under the administration agreement on behalf of Catalyst Dublin. So we have the backstop, if you will, of Catalyst Housing, whom we've worked with on the 4 other projects, guaranteeing the obligations of the special purpose entity, which we think is an added benefit. Finally, I would just note that The project is going to be managed by FPI Management. FPI is the group that handled Annadel and Verdant, those first two projects that Kelcha had. And so as you might recall, in the last two projects, it's been Graystar, but we've moved back to FPI here. That was Catalyst's choice, given the peculiarities with the property and FPI's track record. Other than that, I have reviewed the staff report and looked at the various risk exposures and other ways that we've attempted to address those exposures, and would be happy to answer any questions that the board may have. Thank you.
Thank you very much. Any questions or comments? Supervisor Peterson.
Yeah, Scott, for the information today. Just wondering how the industry is adjusting to this whole rent forgiveness scenario right now under the state of California, and is there any movement in I don't know, legislation, legal action in providing some protections to the opposite side of this thing? I mean, there are a number of properties that are owned and rented, and it's really putting a burden on ownership of projects like this in California. And I'm just curious if you have any insight there.
Yeah, no, it's a great question. We're pretty lucky to date. This will be our fifth asset. In working closely with our asset manager, Catalyst, as well as with our property managers, FPI and Graystar, the whole portfolio is actually doing relatively really well. Again, there's a for people not paying rent, you obviously can't evict them right now with the laws that Governor Newsom passed. But again, in speaking with our, eyes and ears, the real professionals on the ground at each of our projects, we are about 94% collected on rents to date throughout all 4 properties that we currently own. And I think so far, luckily, all the tenants that occupy our projects that we currently own are, still have jobs, still able to pay rent. We really haven't seen a big trickle down effect due to COVID and, related matters. So I think based on what I'm hearing, for Dublin too, and looking at the rent roll and the tenants there, we should be in a good position as well. So at this point, this really hasn't affected Kelcha, and, are going to continue to look for additional opportunities.
Okay, thank you.
Okay, any more questions or comments? Look for a motion. Moved by Supervisor Fagundes, second by Supervisor Neves. Madam Clerk, please call the roll.
Joe Nevs.
Yes.
Richard Valley. Doug Verboon.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes.
5 in favor. We have approved as presented. And we're going to go on now to item 5, public comment. Any person may directly address the board at this time on any item on the agenda or any other items of interest to the public that is with the subject matter jurisdiction of the board. 5 minutes are allowed. Anybody out there have any comments? Nothing? Okay, staff updates.
A quick update. We did have approval last night for the city of Rancho Cordova to join Kelcha. The meeting went really great. As you can imagine, all those local officials down there are just really excited about what Kelcha is doing and are hoping that we can find an opportunity in their city to bring this much needed middle income housing. So we do have a new additional member, and we'll look to approve them as a new member at our next council meeting. But that's it. Thanks for taking the time today, guys.
No, thank you very much. Okay, this meeting is adjourned. Thank you.
Thanks, everyone.